A wrist condition that affects more people that repetitively flex or extend, which would be like a weightlifter, CrossFit athlete, would be intersection syndrome. So it's similar in presentation to DeQuervains, like it's in the same compartment, but it's a little bit more proximal or up the arm. So I kind of marked, there's this bump, and this bump is called Lister's tubercle. If you come in kind of on the thumb side, like that's your radius there, which is the radius is one of the two arm bones. If you kind of feel like in this area, you'll feel a little bit of a bump. And then if you kind of back your way up the forearm, like kind of in those tendons and that muscle, that's where people commonly hurt with intersection syndrome. So what happens in a CrossFit athlete that maybe does a handstand push-up, overhead squat, something that's gonna load the wrist into extension repetitively, and they get really acutely tender, and it's kind of fakes people out because it doesn't feel like it's a wrist issue and it doesn't feel like it's an elbow issue. It's kind of in between, but so it's this intersection syndrome. It actually results in like friction and irritation in those tendons in that space. So honestly, a lot of this is we just have to activity modify and then kind of make sure that wrist and thumb is moving really well. So it's a lot of kind of education on like how to have a neutral wrist. It's a lot of technique stuff. So a lot of times we try to work with CrossFit coaches or the CrossFit athlete to educate like, okay, in this position, we want to really be sure we're not overly hyper extending through our wrists to kind of make up for shoulder mobility loss. Intersection syndrome, so it's kind of just proximal to this Lister's tubercle here, so kind of in through here. We can tape it, we can support it, we can activity modify, return to loaded wrist extension gradually, and hopefully we allow that time to calm down. Ice is fine, over-the-counter inflammatories. The difference is between DeQuervains, right? Remember with DeQuervains, it's more of like this Finkelstein test, so you grab your thumb, or DeQuervains will hurt a little bit more distal, so kind of at the base of the thumb, where this kind of wraps around more kind of on this surface back in through here. So that's intersection syndrome. We want to make sure that wrist is moving. We want to talk about technique to make sure they're not overextended here, kind of lighten up that area. Flexion extension, make sure we can kind of clean up shoulder mobility, specifically, overhead squats. That's a common flaring point that we see. So